My name is Zoe Markham, and I did my undergrad at Chico State University in Northern California, and I did some summer school at Cuesta College. I was at Chico State University consecutively for 4 years, and I did two summer programs at Cuesta College. Yeah, so I spent like academically or for my classes, I spent the most time in the science building. I kind of forget what the name of that science building was, but I had most of my classes, well, a class at least every day in the science building. All of my physical sciences, my health and wellness classes, most of my classes were in the science building, and I had a decent amount of classes in the humanities building as well, and I spent a lot of time in our main library. I did all my studying there. They had really good study rooms with giant whiteboards that you could rent out, so I would get groups of my friends, and I would spend all day there. I don't know if I said I was a public health major. I don't know if I said that. I might have forgotten, but I originally was studying to be a nurse. I was in nursing school, and I did about 2.5 years of nursing school, and I was really putting a lot of effort into getting into nursing programs, and the stars were not aligning for me, and although I had really good scores and grades, I wasn't getting into the programs that I wanted to get into, so I ended up switching my major about 2.5 years into public health. And I was always kind of driven by the desire to help people. I've been in the medical field, or I've been involved in medical situations for a lot of my life, for my own personal medical reasons, and it inspired me to help people in similar situations. So I really wanted to do some sort of work in hospitals or in primary care facilities. And then I switched to public health because I felt like that was more general, and I could kind of implement that in a lot of different fields rather than just in a hospital. But pretty much driven by wanting to help people, and also fascination with the human body and physiology and anatomy. I think those are very interesting subjects. I think a lot of things kind of extended my path. I had a lot of friends equally driven in the same field as me, which is really helpful, and I did various work at different hospitals, and that was really exciting. I did some harm reduction work in college as well, which kind of led me on my path into translating my public health experience into events. I started working for Insomniac when I was about a sophomore or a junior in college. So I was doing harm reduction work on site at festivals, and that was kind of my first intro job and kind of opened the door for me at how I can combine my interests of working large events and working in a public health related field. I was staying in a dorm on site for my freshman year, and then all of my houses that I lived in for the following 3 years were pretty close to campus, so I didn't have any transportation issues. Like I kind of said before, my main challenge when I was trying to be a nurse was it was a really hard field to be in because the competition was very, very extreme. There was I want to say 2,500 kids just in my grade trying to get into a nursing school, and every semester they would only accept 20 to 30 students. So it was very highly competitive. It was really hard to get kids to share information with you if you were trying to study and learn equally. like, luckily I had a couple friends that we were all on the same page, but people were very secretive. They didn't want to help people out. They didn't want to, like, give other people an advantage over them, because it's a very competitive field and you want every piece of information you can get. Also, the teachers were really discouraging, like, because there's such a high population of people interested in the positions available. They're like, oh, if you're not 100% the best, like, I'm going to tell you to leave, and I'm going to tell you not to show up. So a lot of my teachers were discouraging and saying, like, oh, you're not going to be a nurse. And you know what, like I get it. It was very competitive, but it was a discouraging field to be in. After I switched to public health, I had a lot less difficulty with my major. A lot of people are very, like, chill, willing to share, like, learn together. And my classes were really, like, a little bit more easy to digest. I feel like my nursing classes were very, very intense and rigorous, because they wanted to knock people out. Like, they were like, if you can't handle how hard it is, you can leave. So after I switched to public health, it got a lot less challenging. But yeah, that was probably my main challenge before going into school. Excuse me. And besides that, I had a pretty good balance of, I didn't live very close to my family, so it was not super hard to balance family and work life. But I did for a while have a job. Well, my last 2 years in college, I worked in a primary care facility, and sometimes that was too much too much going on, because I was managing a primary care facility and trying to finish my undergrad. I had a wide variety of jobs. I did ticket sales for a box office at the local venue. I was a medical assistant at 2 different primary care facilities and an oncology facility. I had an internship as a program manager for children in cancer families, children with families with cancer program. And yeah, I pretty much bounced between those 4 jobs throughout college. And do you want to hear it after college or just during college?
Any's fine. It could be the ones you had before, during, or after.
Okay. Yeah, during, those were like my main 4. I've also done like jewelry sales for a long time, kind of a lot of random jobs. After college, my first big job was I was a medical tent manager at a festival location, and it was like a venue site, and that was about like my senior year. I was working for doing a couple events every 6 months, and that medical tent manager job kind of opened up the door to a lot of other event industry jobs, like production jobs, ADA jobs, harm reduction jobs, medical assistant volunteer jobs, just stuff like that. I think my major can benefit like students and society. I think public health, I mean, when I was in college, I was going to college during the pandemic. My last 2 years were during the pandemic. And I think public health is an extremely prominent subject in our society today, not only because of the COVID pandemic, but because of the prominence of like illicit substances in our society, because of the awareness of like sexual health, of reproductive health, because of the dramatic divide between like like financial standpoints of a lot of people. Like there's a lot of different factors that public health takes into consideration, whether it's like physical health, mental health, environmental health. Like a lot of these things combine, and I think public health can still help our society figure out how to have more efficient systems, how to cover care better for people, and how to overall spread awareness for a lot of different mental and physical health needs. Sometimes I think our society brushes past a lot of these really important subjects, whether it's in the school system or just in primary care facilities. And I definitely think public health will always be an important subject of discussion in our society. I wouldn't say I have any regrets from my college academic experience. I was a really hard worker. I put a lot of effort into my grades. I got decent grades, above average grades. And one thing I wish I did sooner, but I also don't think I could have realized without doing the path that I originally wanted, was just start at public health, because I did a lot of summer school to make up for the time that I lost. And I really did want to be a nurse, but about 2.5 years in, I realized that I don't think that job was for me, and I still believe that. I'm glad I chose the path that I did, and I'm really happy with where I ended up. But it would have been amazing if before I spent 2.5 years of my life doing rigorous studies and really intense subjects, if I realized I wanted to do event services more than medical. And maybe I could have honed in my studies on special events, because that sounds really fun. And if I were to go back to school today, I probably would do something along those lines. So that's my one thing I wish I could rewrite a little bit, but I also am really happy with my public health degree. I think it's a really important and relevant degree to have, especially in this society. So I don't necessarily regret having a public health degree. What is next for me? Well, I have a sustainable clothing and accessory and trinket business, and I have been focusing a lot on sustainable clothing production, I guess you could say. And I feel like I've spun my public health degree into how can we be more sustainable as a society in my brain. And although I still am interested in harm reduction and public health, I'm kind of taking a different path and now figuring out how we can, as a society, produce less waste. I have done a lot of sustainability jobs recently, and my business is really fun for me. So I've been honing in a lot on sustainable textile art and making jewelry, making accessories, and I'm a vendor at medium-sized festivals. So I've been doing that a bunch, and I hope that I can dedicate more time to that, because I do see this growing into something that I will spend the rest of my life doing. So I want to hone that in more and get creative with it. And I'm also moving to Utah, and I will be a snowboard instructor for the winter.